Imagine your brain as a bustling city, alive with energy and activity, filled with countless messages zipping back and forth at lightning speed. Every second, billions of signals are sent and received, coordinating everything that makes you, you. These messages are tiny electrical signals traveling along intricate pathways called neurons. Neurons are like the roads and highways of this city, connecting different neighborhoods and allowing information to flow seamlessly from one area to another. They control everything you do, from the most basic actions like breathing and blinking, to the complex processes of thinking, feeling, and interacting with the world around you. Every movement, every thought, every emotion is orchestrated by this vast network. Normally, this electrical activity is orderly and controlled, like well-managed traffic flowing smoothly through the city streets. Signals stop and go at just the right times, ensuring everything runs efficiently and without confusion. A seizure, however, is like a sudden chaotic electrical storm in the brain. Imagine a lightning strike hitting the city, causing all the lights to flicker and alarms to blare. In an instant, the calm order is replaced by confusion and unpredictability. It's a brief, uncontrolled surge of electrical activity that disrupts the brain's normal function. This surge can last just a few seconds or several minutes, but during that time, the brain's usual communication is thrown into disarray. This sudden burst can cause a wide range of temporary changes in behavior, movement, sensation, or awareness. Some people might lose control of their muscles, while others may become confused, unresponsive, or experience unusual sensations. It's important to understand that this disruption isn't a sign of mental illness or intellectual disability. It's a neurological event, meaning it originates from the brain's physical processes, not from a person's character or intelligence. Think of it like a computer suddenly freezing or glitching because of a power surge. The system itself is still intact, but the flow of information has been temporarily scrambled, causing programs to crash or behave unpredictably. The hardware, your brain, is fundamentally sound, but its electrical system has momentarily gone haywire. Once the surge passes, most people return to normal, just as a computer reboots after a glitch. But what causes this sudden electrical storm? The answer is complex, and the triggers can be as varied as the people who experience them. The reasons for this surge can vary widely. Some people may never know exactly why they had a seizure, while others can pinpoint a specific cause or trigger. For some, it might be due to a condition called epilepsy, which is characterized by a tendency to have recurrent seizures. Epilepsy affects millions of people worldwide, and while it can be managed, it often requires ongoing care and attention. For others, a seizure could be triggered by an injury, such as a blow to the head, an illness like meningitis, a high fever, or even low blood sugar. Sometimes, certain medications or withdrawal from substances can also provoke a seizure. In many cases, the precise cause remains a mystery, a complex puzzle that neurologists continue to work on. The brain is incredibly intricate, and even with modern technology, some answers remain just out of reach. So, what exactly is happening during this electrical overload? Let's take a closer look at the science behind a seizure. The brain's nerve cells, or neurons, start firing in a highly synchronized and excessive manner. Instead of the usual carefully timed signals, there's a sudden burst of activity that spreads rapidly. Instead of communicating in an organized fashion, large groups of them all shout at once. Imagine a classroom where every student starts yelling at the same time. No one can be heard and chaos takes over. This abnormal rhythmic firing overwhelms the brain's normal signaling pathways. The usual flow of information is drowned out, and the brain struggles to process what's happening. The specific effects of a seizure depend entirely on which part of the brain this electrical storm hits. Each region of the brain controls different functions, so the symptoms can vary dramatically. If it occurs in the motor cortex, the part controlling movement, it might cause convulsions or jerking limbs. These are the dramatic seizures most people picture, but they're just one type. If it happens in the temporal lobe, responsible for emotions and memories, a person might experience strange feelings or sensations, like a sudden wave of fear, a sense of déjà vu, or even vivid hallucinations. This complex event is not a single, uniform experience. Seizures come in many different forms. Some affect movement, others affect awareness, and some are so subtle they might go unnoticed. Some are dramatic and easily recognizable, known as generalized tonic-clonic seizures, which involve the whole body. These can be frightening to witness, but they are only one piece of the puzzle. However, many are far more subtle. A person might simply pause, lose focus, or display a slight twitch, signs that are easy to miss if you don't know what to look for. A person might simply stare blankly for a few seconds, a type known as an absent seizure. These brief lapses in awareness can happen dozens of times a day, especially in children. They might experience odd smells or tastes, a sense of déjà vu, or brief muscle twitches in one part of their body. Sometimes a seizure can be as subtle as a sudden feeling of confusion or a strange sensation that's hard to describe. Understanding that seizures are a physical interruption of the brain's electrical system is the first step toward demystifying this common, yet often misunderstood condition. By learning more about what seizures are and what they are not, we can help reduce stigma, support those affected, and encourage compassion and awareness in our communities. For some individuals, a seizure doesn't just appear out of the blue. While it might seem sudden to an outside observer, the person experiencing it may have a sense that something is about to happen. This early warning can be subtle, but for those who know what to look for, it can make a significant difference in how they respond. There can be preceding signs, subtle warnings that the brain's electrical balance is becoming unstable. These signs are often so faint that they might be dismissed as imagination or stress. But for people with epilepsy, they can be the first clue that a seizure is on the horizon. These pre-seizure symptoms are often referred to as an aura. The word aura comes from the Latin for breeze or air, and it captures the fleeting, almost intangible nature of these sensations. For some, the aura is a gentle nudge. For others, it's a clear and unmistakable signal. An aura is not something mystical. It is, in fact, a small focal seizure that hasn't yet spread to affect consciousness or cause more obvious symptoms. Neurologists recognize the aura as a clinical event, a sign that abnormal electrical activity is beginning in a specific part of the brain. It's the very beginning of the electrical storm, confined to a small area of the brain. On an EEG, this might show up as a brief, localized burst of unusual activity, often too subtle to cause any outward signs. The experience of an aura is unique to the individual and depends on which part of the brain is initially affected. No two people experience their auras in exactly the same way, and even for one person, the aura can change over time or from one seizure to the next. It's a personal alarm system that, with experience, a person can learn to recognize. Many people keep journals or use smartphone apps to track their auras, helping them identify patterns and triggers that might make seizures more likely. The types of warnings can be incredibly varied. Some are so subtle that they might be overlooked, while others are so striking that they stop a person in their tracks. The diversity of aura experiences reflects the complexity of the human brain. A person might experience sensory changes, such as seeing flashing lights, spots, or zigzag lines that aren't there. These visual disturbances can be brief or last several minutes, and they often appear in the same part of the visual field each time. They might hear a buzzing or ringing sound, or even a specific tune playing in their head. Sometimes the sounds are so realistic that the person looks around to see if anyone else can hear them. Some report strange smells like burning rubber or a particular perfume, or unusual tastes that have no source. These phantom sensations can be vivid and sometimes unsettling, but they are a well-known part of the aura experience. Emotional changes are also common, including a sudden, unexplainable feeling of intense fear, anxiety, or even joy. These emotions can be overwhelming, and they often come on without any clear reason, making them especially confusing for the person experiencing them. A powerful sense of déjà vu, the feeling that you've lived through the present moment before, or its opposite, jamais vu, feeling that a familiar place is suddenly foreign, can also be part of an aura. These experiences can be so strong that they momentarily disconnect a person from their surroundings. Physical sensations can also act as a warning. These might include tingling, numbness, or a strange feeling in a limb or on one side of the body. A person might feel a rising sensation in their stomach, similar to the feeling you get on a roller coaster. This sensation, sometimes called an epigastric aura, is a classic warning sign for some types of seizures. They might experience numbness or a tingling feeling in a specific part of their body, like their hand or face. Occasionally, these sensations can spread or be accompanied by a sense of heaviness or weakness. Some people describe feeling dizzy, lightheaded, or having a headache just before a seizure begins. These physical symptoms can be mistaken for other conditions, but for someone with epilepsy, they may be a familiar warning. These signs can last from a few seconds to a few minutes, providing a crucial window of time for the person to find a safe place, sit or lie down, and alert someone nearby that they might be about to have a seizure. In some cases, this window is just long enough to prevent injury or to let others know that help may be needed. This forewarning is an invaluable tool for maintaining safety. It allows people to take precautions, such as moving away from sharp objects, sitting down, or notifying someone they trust. So can other people spot these signs? It's a question that many friends and family members ask, hoping to help their loved ones stay safe. Generally, the answer is no. An aura is an internal, subjective experience. Unless the person describes what they're feeling, it usually goes unnoticed by those around them. Since it involves personal sensations, feelings, or perceptions, there are usually no outward signs that an observer could notice. The person may look completely normal, even as their brain is sending them these early warnings. You can't see someone else's feeling of dread or smell the scent of toast that only they can detect. These experiences are invisible to everyone except the person having them. However, an observant friend or family member might notice a person's behavior change subtly. They might see a pause, a distant look, or a sudden shift in mood or attention. They might see the person suddenly stop talking, look confused, or seem distracted. Sometimes the person may pause in the middle of an activity or seem to lose track of what they were doing. If the person has shared what their specific aura feels like, others can be more attuned to these small behavioral shifts and ask if they are okay, offering support before the main seizure event begins. Open communication and awareness can make a real difference, helping to ensure safety and provide reassurance during what can be a frightening experience. Witnessing someone have a seizure can be frightening, especially if you've never seen one before. The suddenness of the event, the loss of control, and the reactions of those around you can all add to the sense of panic. But knowing what to do and what not to do can make a huge difference, not only for the person having the seizure, but also for everyone present. By learning a few simple steps, you can transform fear into effective action. The most important thing to remember is to stay calm. Your calm presence can help keep the person safe and reassure others around you. When you remain composed, you set the tone for everyone else, helping to prevent panic and confusion. Take a deep breath, assess the situation, and remind yourself that most seizures are not life-threatening. Most seizures are not medical emergencies and will stop on their own within a few minutes. It can feel like a long time while you're waiting, but patience is key. Try to keep track of the time, and remember that your main job is to keep the person safe until the seizure ends naturally. The key is to protect the person from injury during the event. Seizures can cause sudden, uncontrolled movements, and the risk of harm comes mostly from the environment around them. Your quick thinking can prevent bumps, bruises, or more serious injuries. Start by gently guiding them to the floor if they are standing, and move any hard or sharp objects, like furniture or glasses, away from them. If possible, clear the area around them so they have space to move without hitting anything. If they're wearing glasses, carefully remove them to prevent breakage or injury. Avoid the instinct to restrain them or hold them down, as this can cause injury to both you and them. Let the seizure run its course. Trying to stop their movements can lead to broken bones, muscle injuries, or even more distress for the person experiencing the seizure. One of the most crucial steps is to protect their head. Place something soft, like a folded jacket or a cushion, under their head to prevent it from hitting the floor repeatedly. This simple action can help prevent head injuries, which are one of the most common complications during a seizure. If they are wearing anything tight around their neck, such as a tie or a tight collar, loosen it to ensure their breathing is not restricted. This is especially important if the person is lying on their back, as it helps keep their airway open and reduces the risk of breathing difficulties. Try to turn the person gently onto their side, into what is known as the recovery position. This is especially important if they have saliva or vomit in their mouth, as it helps keep their airway clear and prevents them from choking. If you're unsure how to do this, remember, gently roll them onto their side, bend the top leg, and tilt the head slightly back to keep the airway open. Do not, under any circumstances, put anything in their mouth, not your fingers, a spoon, or anything else. It is a myth that a person can swallow their tongue during a seizure. In fact, putting objects in their mouth can cause choking, broken teeth, or other serious injuries. As the seizure happens, try to time it. Note when it started and when it finished. This information can be incredibly useful for medical professionals if they are needed. If you can, also observe what the person was doing before the seizure, how their body moved, and how long it took for them to recover. These details can help doctors determine the type of seizure and the best treatment. Most seizures last less than 2 minutes, but if a convulsive seizure continues for more than 5 minutes, it's considered a medical emergency, and you should call for an ambulance immediately. Prolonged seizures can be dangerous and require urgent medical attention to prevent complications. You should also call for help if the person has one seizure right after another, without regaining consciousness in between, if they appear to be injured, or if they have trouble breathing afterwards. Other warning signs include if the person is pregnant, has diabetes, or if the seizure happened in water. In these cases, immediate medical attention is essential. It's also important to seek medical help if you know it is the person's first seizure. First-time seizures can be a sign of an underlying medical condition that needs to be evaluated by a healthcare professional. Don't hesitate to call for help if you're unsure. After the seizure stops, the person will likely feel confused, drowsy, and disoriented. This post-seizure state is called the postictal phase. They may not remember what happened, and it can take several minutes or even longer for them to fully recover. Be patient and supportive during this time. Stay with them and speak to them in a calm, reassuring voice. Explain what happened in simple terms and let them know they are safe. Offer comfort and answer any questions they may have, but avoid overwhelming them with too much information right away. Help them find a quiet place to rest until they feel ready to get up. A calm, peaceful environment can help them recover more quickly. If possible, stay with them until they are fully alert and able to move around safely on their own. Don't offer them any food or drink until you are certain they are fully awake and alert. Swallowing can be difficult immediately after a seizure, and giving food or water too soon can lead to choking. Your kindness and simple first aid can make a world of difference, turning a potentially dangerous and scary event into a managed situation. By staying calm, protecting the person from harm, and knowing when to seek help, you can provide comfort and safety when it matters most. Remember, your actions can help the person recover with dignity and reassure everyone involved that they are not alone. Receiving a diagnosis of epilepsy or a seizure disorder can feel overwhelming, but it is important to remember that it does not have to define a person's life. With the right management strategies and support, individuals with seizures can lead full, active, and productive lives. The cornerstone of management for many is medication. Anti-epileptic drugs, or AEDs, are highly effective for a majority of people, working to stabilize the brain's electrical activity and prevent seizures from occurring. Finding the right medication and dosage can sometimes take time and requires working closely with a neurologist, but for many, it provides excellent seizure control. Beyond medication, lifestyle choices play a significant role in managing seizure activity. Identifying and avoiding personal seizure triggers is key. Common triggers can include a lack of sleep, high levels of stress, illness or fever, and for some, flashing lights. Keeping a regular sleep schedule is one of the most powerful tools for seizure management. Similarly, developing healthy ways to cope with stress, such as through exercise, mindfulness, or hobbies, can reduce the likelihood of a seizure. A balanced diet and staying hydrated also contribute to overall brain health, creating a more stable internal environment. Building a strong support network is also essential for navigating life with seizures. This includes family, friends, and colleagues who understand the condition and know how to help if a seizure occurs. Joining a support group, either online or in person, can be incredibly empowering. Sharing experiences and advice with others who truly understand can combat feelings of isolation and provide practical tips for daily living. Educating those around you about your seizures can also foster a safer and more supportive environment at home, school, or work, reducing stigma and fear. Ultimately, living well with seizures is about focusing on what you can do, not what you can't. It's about taking proactive control of your health through medication adherence, healthy habits, and open communication. People with epilepsy are doctors, artists, athletes, and parents. They contribute to society in countless ways. By embracing a comprehensive management plan and a positive outlook, the challenges posed by seizures can be effectively managed, paving the way for a life that is not limited by the condition, but is instead lived fully and with purpose.